More than 370 million people suffer from diabetes worldwide. Other tech companies are also said to be working on similar products. This could be a game changer in the medical world. And joining me now is KTVU medical expert Dr. Larry Burchett. Larry, I think I know the answer to this, but this is a big deal, right?
This is a really big deal. Yeah, you mentioned hundreds of millions of people worldwide, and millions of Americans have to check their blood sugar 3 times a day. This is Dr. Ameer Moussa. He works with me in the hospital, and he is diabetic. Go ahead and show him your fingers a little bit. He's been checking his blood sugar for how long?
Somewhere about 15 years now.
15 years, 3 times a day. And you can see, you can't really see when you... He's got some little sticks because he always does this and switches hands. It's painful. It's one of the excuses we get of why people hate being diabetic and having to deal with all this. If you had a device you could just put on your finger or your iWatch, that would be a game changer. It would be very helpful for patients.
Well, let's take that a little further now. I guess it does interface with the iWatch, or at least that's what I heard. Talk about that if you can.
These apps and devices, for them to kind of bring all of this medical information together. I mean, imagine if you had a device that could do your blood pressure, your blood sugar, maybe even your cholesterol, all these things that we follow with sometimes invasive tests like blood tests, getting your blood, or even doing CAT scans. The more of this stuff that can just kind of automatically do it and put it in one place conveniently, like, you know, online from Apple, it just makes it so much easier to track it, to follow it. You see some of those graphs. It's ultimately better for patient care. I'm sure it would translate into, you know, saving lives.
And I understand the idea actually came from the late Steve Jobs. Before he passed away, he got this started.
I have no idea where this technology came from or how they're getting it to work, but it's certainly exciting to us in the medical profession. We wanted to show you, Frank, we've got the current blood sugar monitor and how you have to stick your finger. I wanted to do that real quick if we've got a second.
Absolutely. Go right ahead, doctor.
Okay. So this is the device right here. And Dr. Moose is going to go ahead and stick my finger. I'm a little bit afraid. I'm not going to lie. It's kind of like, now you'll see, kind of got to squeeze a little blood there. And then what do? We take this thing.
You take that, and then you put the blood right over there. And it takes it, and then it'll show you your blood sugar.
See if we can show that to you.
It'll show you the blood sugar.
In 5 seconds.
Wow.
101. I just ate something a little bit ago. It didn't hurt too bad. It was kind of like a light rubber band, but enough that 3 times a day, that would kind of get old and get annoying. I mean, how bad does it bother you now?
Well, I've gotten used to it, but some device that would be able to put it on my wrist, show me all my blood sugar trends, would help me significantly, not only with my insulin use, but with my overall diabetic care. So using something like that.
You'd be pretty excited about it.
I would probably buy another iWatch.
You'd buy an iWatch.
I was just going to say, an iWatch used to be, boy, that'd be nice to have. Now it would be, if you're a diabetic, that's something I got to have. Right, doctor?
Yeah, definitely. I would imagine it would probably get covered by insurance, and people, it would be that superior to what we've got now that everybody would get it.
All right. Well, both doctors, we thank you for your insight, and hopefully Apple can get this on the market and help out a lot of diabetics out there. Great stuff. Thanks, guys.
Thank you.